Staying onto the example of doing your notes more efficiently, because that just happens to be the thing that keeps interns in the hospital longest, it's really hard to kind of focus on things when you're getting pages and we're not sure when to put orders in. Usually I like to create a very systematic thing. My first rule is if I get a page, if it's not urgent, I'm not going to respond to it immediately. I'm going to finish that thing that I'm doing. That just keeps me focused, keeps me in a sense of flow. And the next thing is I kind of go from patient to patient instead of trying to go back and forth between notes and orders and notes and orders. An example I would use is once I've rounded all my patients, I would want to first do the note of the person who's going to take the longest time. Usually it's very typical for us to do the quickest notes quicker just so we can feel like we're at a sense of accomplishment. But the thing that's probably going to kind of delay us later in the day is trying to work on those very busy, dense notes later on. So instead I try to do those first, and usually they happen to be my sickest patients anyways. So I pull up their notes, I pull up their orders, and I pull it in the orders that I want to do for the day, and I try to work on that note as quickly as possible.